Hi, I'm Caleb Vasco, and welcome to 4 Minutes of Boredom. Today we're going to talk about digestive or peptic ulcers. A digestive ulcer is when the stomach acid will etch away at the stomach lining and upper parts of the small intestine. This is usually caused by bacteria, but can also be caused by stress and the overuse of non-steroidal anti-inflammatory medications. Aspirin, pretty much. They're officially diagnosed as sores in the stomach and the roof of the small intestine by a doctor or specialist. The testing for stomach ulcers and digestive ulcers is a pain on its own, some of which include taking a blood, stool, or breath test. Others include the barium swallow, which is a thick liquid that you drink. It tastes absolutely wretched, by the way. It's horrible. And it coats the GI tract to help the doctor see into the stomach using an x-ray. There's also the EGD, or endoscopy, which is where a thin lighted tube is placed down your throat and into the stomach and the beginnings of the small intestine, and it has a little camera on the end that looks inside your stomach. Digestive ulcers affect mostly the digestive system through the increased acidity of the stomach acid and pains in the digestive tract. However, ulcers in turn can affect the nervous system through pains and changes in voluntary responses to accommodate the bacteria and pain, as well as a lack of oxygen to the brain on rare occasions. They can also affect the muscular systems, because in many cases people with ulcers will lose their appetite and lack necessary nutrients, making them weak and preventing their muscles from growing or working properly. Lastly, there's the circulatory system and respiratory system, which are affected by the body not having the energy to do many tasks, which includes circulating blood and oxygen. Ulcers can make it hard for the body to take in air and funnel oxygen into the bloodstream and therefore the brain and muscles. Symptoms of digestive ulcers include paler yellow skin, weakness, shortness of breath, irregular heartbeat, dizziness, unnecessary vasoconstriction, which is where your hands and feet get really cold, nausea and vomiting, anemia, bloody vomit, heartburn, chest pains, stomach or gastric pains, bloating, weight loss, lack of appetite due to pain, acid reflux, and a pain that goes away when eating or drinking, but returns shortly after. It's a lot, I know. But there are ways to treat it. Some forms, like H. pylori, however you pronounce that properly, is when you'll take an antibiotic called a proton pump inhibitor, a PPI, as well as H2 receptor blockers to block acid production. Bismuth supplements, probiotics, and the stopping use of anti-inflammatory drugs, such as aspirin, are recommended. Complicated stomach ulcers, however, may need surgical treatment. This can involve the full removal of the ulcer, the patching of tissue over the ulcer, the tying off of a bleeding artery, or the cutting off of the nerve supply to the stomach, which will in turn reduce the production of stomach acid. Sorry about that. My little stand doesn't want to work. You can avoid ulcers through healthy diets, washing your hands frequently to avoid the bacteria, properly cleaning your food, and limiting the use of non-steroidal anti-inflammatory medications. So don't take 8 aspirin a day. That's not healthy. Just don't. And thank you for listening. Hope you appreciate that I went through probably too much information and research on this, but bye.